Now we go to the back transporting points. The bladder 15, Xinshu. The bladder 15 location is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the fifth thoracic vertebra, or T5. How to find? First, we need to locate the spinous process of C7. From there, count down 5 spinous processes to the lower border of the spinous process of T5. Measure 1.5 tune lateral to locate bladder 15 on the highest point of the paraspinal musculature. Or with the patient seated and their arms hanging down, the spinous process of T3 is generally on the level of the easily palpable medial end of the scapular spine. From there, count down 2 spinous processes in an inferior direction to the T5. Locate bladder 15, 1.5 tune lateral to the midline. Located on the same level are do 11 on the midline, a point of EXB2, 0.5 tune lateral to the midline, and bladder 44, 3 tune lateral to the midline. Okay. Sa needling, 0.5 to 1 tune obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needling retention. The needles can be secured with tape. Caution is pneumothorax. For the action and indication, this bladder 15 tonifies and nourishes the heart, regulates the heart chi, unbinds the chest and removes blood stasis, calms the Shen, clears fire, moves chi locally and along the channel pathway. For example, for disorder of the thoracic spine and intercostal region. For these special features, bladder 15 is the Back-Shu point of the heart. Bladder 15 is a very important point for many heart patterns. Firstly, it calms the mind and can be used for nervous anxiety and insomnia, mostly deriving from excess conditions of the heart, such as heart fire or heart empty heat. In these cases, it is needled with reducing method. It also calms the mind by nourishing the heart, and for this reason, it is used for poor memory and insomnia. At the same time as calming the mind, it also stimulates the brain if used with reinforcing method or with direct moxibustion. In particular, used with direct moxibustion, it has a good effect in stimulating the brain and is effective for depression, mental confusion, and poor concentration in adults and slow development in children. Bladder 15 also moves chi and invigorates blood and is therefore used for pain and chest deriving from stasis of blood. Bladder 15, the summary of functions, it calms the mind, anxiety, weeping, fright, insomnia, excessive dreaming, manic depression. Nourishes the heart, disorientation, delayed speech development, poor memory, poor concentration, mental confusion, heart chi deficiency in children. Stimulates the brain, clears heat, regulates heart chi, and invigorates blood, heart pain, fullness of the chest pain, palpitation, irregular pulse. Bladder 15 is the Back-Shu point of the heart, where chi of the heart emanates from the interior to the body surface and in common with all the Back-Shu points, especially those of the Yin Zang. Bladder 15 has a strong action on regulating and tonifying its corresponding Zang-Fu at the deepest level. It is used equally to tonify deficiency. The heart is unique and among the Zang-Fu in that it commonly suffers from all the 4 main kinds of deficiency. blood, yin, qi, and yang. And to resolve excess pathogenic factors such as blood stasis, heart fire, and obstruction by phlegm. The heart controls the pulse, and when heart qi is deficient and is unable to regulate the blood, there may be palpitations or regular pulse, especially if the heart blood is also deficient. In the latter case, palpitations will be more likely to be accompanied by anxiety, in contrast to the palpitations caused purely by qi deficiency, which are usually unrelated to emotional changes. In fact, palpitation may accompany any pattern of heart disharmony, whether excess or deficient, and in all these cases, bladder 15 may be selected. The heat clearing action of bladder 15 finds its most important expression in the treatment of excess type psycho-emotional disorders. When the heart fire rages out of control, it agitates and excites the spirit, leading to such symptoms as severe insomnia and excessive dreaming. When heart fire combines with phlegm and obstruct the portals of the heart, there will be severe disorder of the spirit such as epilepsy, dementia, mad walking, and mania depression. The heat clearing action of bladder 15 extends beyond the heart itself, and the illustrated supplement of the classic of categories states that bladder 15 is one of the 5 points, bladder 13, bladder 15, bladder 18, bladder 20, and bladder 23, which drain heat from the 5 Zang. Seminal emission may present in a number of different patterns and is broadly differentiated into seminal emission accompanied by dreaming and seminal emission without dreams. Seminal emission with dreams may be due to heart fire, heart and spleen deficiency, heart and kidney deficiency, ministerial fire, or damp heat. Even in cases where the heart is not directly involved, however, if seminal emission is accompanied by erotic dreams, bladder 15 is indicated. Finally, in common with most of the yin Back-Shu points, bladder 15 is able to treat the issues and sense organ associated with its corresponding sun. The tongue is the sprouting fork of the heart, and bladder 15 is indicated for slow speech development in children and lack of strength in the root of the tongue. Bladder 15 is also indicated for lacrimation and eye pain. This indication, however, reflects disorder of the heart channel rather than the heart Zang. Thank you for your attention.